So, in order to learn the sympathomimetic, we should know where the receptors are located in the body. So, we have alpha and beta type of receptors. Alpha 1 and alpha 2, beta 1, beta 2, and beta 3. Alpha receptors are found in the smooth muscles, and the effects are vasoconstriction and the smooth muscle contraction. Okay. Alpha 2, pancreas and presynaptic terminals and salivary gland, and it causes the inhibition of the insulin secretion, inhibition of the neurotransmitter release, and inhibition of salivary secretion. Beta 1, these are found in the heart and kidney, and these increase the heart rate, contractility, and increase the renin secretion. Beta 2, they are found in the bronchioles, cardiac muscle, liver, arterial smooth muscle, and the pancreas. And it causes in the lungs, it causes the bronchodilation. In the cardiac muscle, it causes the heart rate to increase, and contractility also to increase. Then in liver, it causes the glycogenolysis, that is the breakdown of the glycogen into glucose, and result in glucose release and vasodilation in the case of arterial smooth muscle, and pancreas, it causes the stimulation of the insulin secretion. Beta 3, these are the only receptors present in the adipose tissue, and it causes the lipolysis. So, in this chart, I have summarized all the important drugs which are included in the sympathomimetic drugs. So, we have two types of drugs. First is the direct acting drugs, and second is the indirect acting drugs. The direct acting drugs, they directly stimulate the alpha or the beta receptors, and indirect acting drugs, they either cause the release of neurotransmitters, or they inhibit the uptake of neurotransmitter, therefore causing the increase half life of the drug, and therefore causing the increase life. So now we will discuss about the alpha 1 selective agonist. So, as the name itself tells us, that these drugs will only uh, select alpha 1 receptors, and cause the physiological response. So, remind me that alpha 1 receptor, when stimulated, causes the vasoconstriction, and they increase the BP. Okay. So these are useful in the nasal decongestants, and the drugs which are in this list are the phenylephrine, oxymetazoline, and the methoxamine. Okay. So, phenylephrine is a vasoconstrictor that raises both systolic and diastolic blood pressures. Phenylephrine acts as a nasal decongestant applied every 4 hours, and produces vasoconstriction. Now, alpha 2 selective agonists. So, these drugs will only stimulate the alpha 2 receptors. And remind me that what do the alpha 2 selective agonists do? They will prevent the rise of BP. Actually, they will inhibit the neurotransmitter release, and will cause the decrease in the BP. So, clonidine is an alpha 2 agonist that is used in the essential hypertension to lower BP because of its action in the CNS. It can be used to minimize the symptoms that accompany withdrawal from the opiates, tobacco smoking, and benzodiazepines. And other drugs are the guanfacine and the guanbenzine. So here are the list of the nasal decongestants used to treat the rhinitis and the inflammation of the nose. So we have uh, nafazoline, oxymetazoline, xylometazoline, phenylephrine, and the pseudoephedrine. Okay, so we have beta 1 selective agonist. So dopamine is used to increase the cardiac output in acute congestive heart failure as well as to for the inotropic support after cardiac surgery. The drug increases cardiac output and does not significantly elevate the oxygen demand of the myocardium, a major advantage over other sympathomimetic drugs. Okay, so now beta-2 selective agonists. So these drugs will will cause the bronchodilation and the peripheral vasodilation. Okay, and these drugs will decrease the BP. So the drugs are the salbutamol, salmeterol, formoterol, terbutaline, and the clenbuterol. Okay, and BT2 adrenosterol agonist causes bronchodilation used for treating asthma, bronchial asthma attacks, and bronchitis. And it also prevent preterm labor, uh, relaxing uterine muscle, genipalia, hexoprepineline. It causes a relaxation of the uterus. Okay. So so in the right side of the slide you can see the pictures of the albuterol and terbutaline. These are the short acting beta 2 agonists, and these are not used for the prophylaxis. Okay, and salmeterol and the formoterol, these are used in the prophylaxis, and these are long acting. Okay, G. So now we have non-selective beta agonists. So these are non-selective. It means that these drugs will bind to alpha beta 1 as well as beta 2. Okay. So we have isoproterenol and the isoprenaline and the orciprenaline. Okay. So isoproterenol, it acts as a cardiac stimulant, and it has a bronchodilation and positive inotropic effect. Okay, so we have now alpha and beta agonists. Okay, so these drugs will stimulate the alpha as well as the beta receptors. So we have epinephrine, norepinephrine, and the dopamine. Epinephrine, these are the alpha. This stimulates the alpha 1, alpha 2, beta 1, and beta 2. And this is a drug of choice for anaphylactic shock. Norepinephrine, this stimulates only three receptors, that is the alpha 1, alpha 2, and the beta 1. Okay. And dopamine also stimulates the alpha 1 and the beta 1, and the dopaminergic receptors in the brain and in the renal vessels and in the splanchnic vessels. Okay. And it is a drug of choice for septic and cardiogenic shock. Okay. Indirect acting adrenomimetics. So these cause norepinephrine release from the presymptomatic terminals or inhibit the uptake of norepinephrine. This they potentiate the effects of a norepinephrine produced endogenously, but these agents do not directly affect the host symptomatic receptors. Okay. Example is the amphetamine can increase BP significantly by alpha 1 agonist action on the vasculature as well as the beta stimulating effect on the heart. Its peripheral actions are mediated primarily through the blockade of a norepinephrine uptake and cellular release of a stored catecholamines. Thus, amphetamine is an indirect acting adrenergic drug. Now, another drug in the class of indirect acting adrenomimetic is the cocaine. Cocaine has a unique among local anesthetic in having the ability to block the sodium potassium activity ATPase, which is required for the cellular uptake of norepinephrine on the cell membrane of the adrenergic neuron. So this token will block this channel. So therefore the uptake of the norepinephrine will be blocked. So norepinephrine will remain in the cleft, in the synaptic cleft, and therefore increasing the enhancement of the sympathetic activity and the potentiation of the action of the epinephrine and norepinephrine. So we have mixed acting adrenomimetics. So mixed action drugs induce the release of a norepinephrine from the presensory terminals, and they activate adrenergic receptors on the postsynaptic membranes. Okay, so uh, ephedrine and the pseudoephedrine. They not only release the stored norepinephrine from the nerve endings, but also directly stimulate both alpha and beta receptors. Thus a wide variety of adrenergic action ensure that are similar to those of epinephrine, although they are less potent. Ephedrine and pseudoephedrine are not critical. They are not criticals and are poor substitutes for COMT and MAO. COMT means carboxy. Sorry, catechol, catechol O methyltransferase, and the MAO means monoamine oxidase. These are the enzymes which are important for the degradation of the epinephrine and the norepinephrine, and yeah. Therefore, these drugs have long duration of action. So as you can see in the diagram, ephedrine and the pseudoephedrine, they stimulate the alpha and beta receptor, and they also penetrate the CNS and enter the CNS, and they cause the they are used as a nasal decongestion, and they also raise the BP. So here are some adverse effects of using this adrenergic agonist. So we have the arrhythmia, headache, hyperactivity, insomnia, nausea, and the tremors. Thank you guys for watching till the end. And if you like my video, please consider subscribing and liking my video. Thank you.